Okay, we're gonna have a look at our slump flossing exercise. This is we call it flossing because basically what we're doing is as we move into a position like this, the nervous system moves up towards the head. So spinal cord, everything kind of pulls up. As we move into a position like this, the nervous system pulls down towards the feet. So if we move back and forward like this, you can imagine that kind of long string of the nervous system kind of gliding up and down in the spinal cord. So we're often going to use this for people who get some kind of pain in this area between the base of the neck and the low back with forward bending positions or forward bending and deep breathing, and you just kind of feel like irritable. Or people who struggle with like a forward bend towards the toe touch, range of motion, and find that you just feel like really lit up maybe from your back all the way down the backside of the legs. Another kind of cue that your nervous system could be a little bit grumpy is if when you're doing that toe touch movement, you feel a lot of stretching down in the calves, which we know is not really the target of this movement, and your calf muscle is not on stretch, so it does tell you that the nervous system is a little bit more grumpy or a little bit more irritable as you move into that forward bend pattern. Anyhow, so nerve flossing, what we want to do is start with our back kind of curled up like this. We can sort of roll the pelvis back into a slouchy position, got our chin down on the chest, gonna take a breath in, and then exhale as we straighten up. Inhale, exhale. And it's okay if you do have pain that you may not be moving as far as what I'm showing here at first, okay? So if you're gonna be here and you kind of come up to here, at this point you start to feel maybe some pain increasing. We don't want to push into that. We want to kind of stay below that painful threshold. But if you've kind of tested that initial level, as you continue on for anywhere from 5 to 30 repetitions, you might notice that you're able to go a little bit higher by the end. Okay, so that's our slump flossing for what we call dural mobility. So it's really mobilizing the length of the spine and taking some sensitivity away from the tissue of the nervous system itself. And so that's what we're trying to achieve here. All right, hope it helps.